Everyone. Today we will discuss on the topic cardiovascular system. Cardiovascular system, it is also called as circulatory system. It consists of heart, blood vessels, arteries, vein, capillaries. What is the function of the cardiovascular system? The function of the cardiovascular system is the transportation of CO2 and metabolic waste product from the tissue to the lungs, other excretory organ, and also distribution of oxygen and nutrient to the all body parts, and distribution of water, electrolytes and hormones throughout the body. Heart, it is a muscular organ. It is composed of strong cardiac muscles tissue. Its heart size is about a closed fist. The average weight of the heart in female is about 250 to 300 grams, and in male 300 to 350 grams. Average human heart beats per 70 to 72 per minutes. Heart is located in the thoracic cavity between the lungs. Layers in the hearts. First is the epicardium, second is the myocardium, and third is the endocardium. Epicardium, it is the outer layer of the heart, consists of two layers, fibrous pericardium and serous pericardium. The second layer is the myocardium, it is the middle layer. Third is the endocardium, it is the innermost layer, and third layer of the wall of the heart. Now, chambers of the hearts. There are four chambers present in heart. Means two atria, which is upper chamber, and two ventricle, that is lower chamber. Right atrium receives the deoxygenated blood from the body and by the superior and inferior vena cava. Right ventricle pumps deoxygenated blood to the lungs through the pulmonary arteries for the oxygenation. Left atrium receives the oxygenated blood from the lungs via the pulmonary veins, and left ventricle pumps oxygenated blood from the entire body through the aorta. Now we see the walls of the heart, which permit blood flow in one direction during circulation. Triventricular walls and semilunar walls. There are four main walls present to prevent backflow of the blood. First is the tricuspid wall, which is present between the right atrium and right ventricles. Then bicuspid wall, it is also called as mitral wall. It is present between left atrium and left ventricle. Then pulmonary wall, present between the right ventricle and pulmonary trunk. Then aortic wall, present between the left ventricle and the aorta. Septum, it is a muscular wall dividing the right and left side of the heart, preventing the mixing of oxygenated and deoxygenated blood. The second point is the blood vessel, which consists of arteries, veins and capillaries. Arteries carry oxygenated blood from the heart except pulmonary arteries. Arteries are thick plastic wall or withstand with high pressure. Veins return deoxygenated blood to the heart except pulmonary vein. Veins are inner wall and often contain walls prevent backflow. Capillaries are the microscopic vessels where gas, nutrient and waste exchange occurs. Their thin wall allows to further diffusion between the bloods and between blood and the tissue. But it is a fluid medium that transport nutrient, gases, hormones and waste product. It is composed of RBC, WBC, platelets, and plasma. RBC carries oxygen via hemoglobin, and WBC, it is a part of immune system fighting infections. Platelets are crucible for blood clotting. Plasma, it is a liquid component containing water, electrolyte, protein, hormones and waste. Now we see the circulation. Circulation, it is a movement of blood vessels throughout the body. There are two primary circulatory loops are present in the human body. First is the pulmonary circulation and second is the systemic circulation. In pulmonary circulation, it transports the deoxygenated blood from the right side of the heart and to the lungs, where the blood picks up the oxygen and return to the left side of the heart. Pumping chamber of the heart that support the pulmonary circulation loop are the right atrium and the right ventricles. And in systemic circulation, it carries highly oxygenated blood from the left side of the heart to all of the tissue of the body, with exception of heart and lungs. Systemic circulation, waste removed from the body tissue and return deoxygenated blood to the right side of the heart. Left atrium and left ventricle are the pumping chamber for the systemic circulation. Now we see the cardiac cycle. It is a rhythmic pumping of the heart. This cardiac cycle. Cardiac cycle, it means when the contraction and relaxation occur during one heartbeat. It is called as cardiac cycle. Phase of the cardiac cycle consists of systole and diastole. When the contraction occurs, in the contraction phase of heart is called as the systole, and in the relaxation phase of the heart it is called as the diastole. The whole process of cardiac cycle is completed approximately 0.8 second. In one contraction means systole and one relaxation means diastole of auricles and ventricle, resulting in one heartbeat. The heartbeat or heart sound is produced by opening and closing of valves. Sound of the heart are produced during the cardiac cycle, especially during the phase of the heart contraction and relaxation. In healthy adult, there are two normal heart sound. First is the love sound and second is the dove sound. Love sound is produced when the atrioventricular walls are closed at the beginning of the ventricular contraction. Atrioventricular walls means the tricuspid and the bicuspid walls when are closed, then the love sounds are produced. Dove sound produced when semilunar wall closed. Semilunar walls is pulmonary and the aortic walls when closed, then the dove sound is produced at the end of the ventricular contraction. Conduction system of the heart consists of SA node. It is means a sinoatrial node, and second is the internodal pathway. Third is the AV node, it means the atrioventricular nodes, bundle of his, and after that the Purkinje fibers. There is a pathway of the nerve impulse. It is the blood pressure. Blood pressure is a force exerted circulating blood on the walls, vital for maintaining the adequate blood flow. It is the term cardiac output. Cardiac output is the volume of blood pumped by the heart per minute, determined by the heart rate and the stroke volume. What are the common diseases and disorders of the heart? Cardiovascular system. Cardiovascular system can lead to conditions such as hypertension, hypotension, coronary artery disease, heart failure, and arrhythmias. Atherosclerosis, characterized by the plaque build-up arteries, can reduce blood flow and lead to ischemic wall event like heart attack or stroke. So that's all about the cardiovascular system. Thank you.